Good morning. Today we have with us Dr. KK Aggarwal, who's just been elected as the Honorary Secretary General of Indian Medical Association, the largest association of doctors in India. He's a recipient of multiple national awards, including the Padam Shri. He's a social activist and an academic excellent individual. It's an honor to have him with us today to get his opinion of what he feels could be the role of Indian Medical Association in trying to somehow sort this issue of severe acute malnutrition, which we know is a medical emergency. It has almost about 80 lakh children in India suffering, most of them in rural, tribal areas, most of them scheduled caste, scheduled tribes, from other backward classes, from Adivasis, more girls than boys, etc. We know that at this point, in spite of all the effort that government is putting in, we have only about 600 nutrition rehabilitation centers across the country, but basically in 4 states. Almost 400 of them are in just 4 states, but these children are dying. They have 9 times higher mortality rates, and we want Dr. KK Aggarwal, and through Dr. KK Aggarwal, the role that these multiple lakhs of doctors in India can play in sorting out this big issue. Dr. KK Aggarwal.
National IMA is a 3-tier system. We have 1700 branches, and if each branch I take 10 activists, president, secretary, treasurer and other ones, I'm talking about 17,000 leaders of the medical profession. Then we have 30 state branches, then we have the national IMA. In the national IMA, we have a central council, which is representative of the branch level, and the working committee, which is representative of a state level, which governs the affairs of the IMA. So IMA is indispensable as an infrastructure for the private sector. As we have a PSC, ESC, and a community hospital, and a district hospital, and a government setup, similarly, there is a parallel system of in a private sector through the medical association. Unfortunately, apart from tuberculosis, IMA is not present in any national program in the country. There is no symbiosis between the Government of India national programs and the IMA. Only one program IMA is running, and that's National TB Control Program, which is through RNTCP, and that is also a global fund project. We at IMA are thinking of appointing 30 directors at each one in each state. They will be IMA directors, whose job will be national health programs in charge at a IMA level. They then will, through the IMA, we are talking to the government that if you want to involve IMA, we will give you one director in each of the state, who will be working as a link between the public and the government for a national health program. Wonderful. Similarly, those programs which government doesn't have, IMA is starting, we will have our own directors for that. So that's one thing which we are trying to do. Now it's on the government's platform to use them and make private sector link with the government sector.
Can we request you, sorry to interject, can we request you to have these directors who would be engaged in national programs to prioritize malnutrition as a major issue?
No. What I'm trying to say is, now amongst these 30 people, they will have to look for the national programs.
Sure.
If suppose that nutrition is there in it is there. If it is not there, then IMA can come out with a national program on acute malnutrition.
Wonderful.
There's no problem. Wonderful. If it is a medical emergency, IMA also feels it's a medical emergency. Wonderful. Now what the IMA can do? Yeah. A, sensitize. We reach 150,000 doctors every day. Yeah. Through social media and electronic media, we have a reach of around 500,000 doctors every day. So we can sensitize people. We can do media sensitization. We can do public sensitization. That's easier. And then we can do implementation, because we have 1700 branches. If each branch at any given time in a day, suppose I call it as an acute malnutrition day, and on that day, if I ask all my 1700 branches to do a function, and if 100 people comes, so 1,70,000 people can be sensitized in one day. So it is possible. So the job of an IMA is A, to sensitize members in the public, B, to implement, C, in the policy making. The national health policy is coming. We are inviting suggestions. IMA is making a document involving all the specialty organizations together, and signatory to them will be all, and we send it to the government.
Wonderful.
If it is felt that acute malnutrition is a medical emergency.
Yeah.
Let it come into IMA's recommendation to the government in the national health policy.
Thank you.
We are willing for that.
Thank you. As we also discussed, it is a medical emergency and it has also needed a continuum of care approach. So you need care in the community, you need care in the facility. And also, apart from the care, you also need special types of feeding. So you need
See, we
therapeutic
have
feeding.
for diarrhea, government recognized ORS.
Yes.
Similarly, we can come out with a something like ORS in a
Yes.
packet,
Yes.
which can be available free of cost to the
Yes.
people
Yes.
where nutrition is a problem.
Yes.
If our government doesn't come out, IMA can collaborate, IMA can endorse,
Yes.
IMA can
Yes.
co-make, IMA can do a partnership, whatever is possible. There is a need of the hour that nutritional diets,
Yes.
locally made, nationally made,
Yes.
or international copy,
Yes.
should be
Yes.
available
Yes.
to the public free of cost through
Yes.
the central, through NHRM
Yes.
or at a very nominal cost, or through CSR funds of various
Yes.
various industry.
Yes.
It should be available to the
Yes.
people,
Yes.
so that the if I have a fundamental right to health, right to
Yes.
education,
Yes.
similarly I have a right to be healthy, so that I am not deprived of food. And if that food is available free of cost, as far as the basic requirements are concerned,
Yes.
IMA is for it.
Thank you.